All right, if we were to see a low back arching in the overhead squat, this can happen from upstream and downstream. So this can be something that happens as a result of something from the T-spine, the thoracic spine, in that rib cage having a little bit of a flare and an opening. It can also happen lower in the pelvis, but we're just going to see that there's a little bit of an arch that happens. And so we'll look at the anterior view first. So our hip flexor complex, that can be involved in pulling our hips into and our pelvis into an anterior tilt. So we have our rectus femoris on the outside here on the most superficial level. That is a knee extensor, but it's also a hip flexor. And then if we were to start to peel back the layers and go a little deeper, what you'll see in here is, I'll try to zoom in for you. Ooh, not that far. Okay, so we have our iliopsoas, we have our iliacus, we have our psoas major and minor, and these guys are involved in that pelvic tilt as well. What's cool to look about what's cool to look at with these parts is that you have some of the hip flexors that may rotate the pelvis forward from the femur and the hip, but you also have the psoas and the iliopsoas that are really giving you a major amount of movement. They're coming all the way up here into your spine, like all the way up, I think, to the L1, almost down to like the T12. Very high attachment points, and so they can pull that forward and be involved in that low back arching. Now, if we were to look then on the posterior side, and we'll start to add some of these back, we see our erector spinae. And so this muscle group, this complex, if that is overactive, it can put us into that kind of similar, more of a flared position, because this is going to contract, and as that contracts, it's going to pull the rib cage down. It's going to pull the rib cage like in a position where this is starting to tilt back, and this part will flare forward. Similarly, we'll see some contraction in that pelvis of that, getting a little bit of that anterior tilt. So those are your muscles that are involved in seeing your low back arching in that overhead squat. The erector spinae, your lats, which are also going to be on that backside that we can add to it, and then your hip flexor complex. The lats also playing a role similarly to the erector spinae, in that they're going to, if these are tight, they have some attachment points down here into the pelvis that are going to contribute to some of that anterior tilt.